Breastfeeding, nature's first vaccine and lifelong gift. Breastfeeding is the process of feeding an infant human milk, either directly from the breast or expressed milk fed through a bottle. It is recommended by health organizations, including the World Health Organization, WHO, to exclusively breastfeed for the first 6 months of life, and then to continue breastfeeding alongside complementary foods for up to 2 years or longer. Breastfeeding offers numerous health benefits for both the infant and the mother, including providing essential nutrients, boosting the baby's immune system, and potentially reducing the risk of certain diseases. What is breastfeeding? Breastfeeding is the act of feeding a baby with milk directly from the mother's breast. It is biologically tailored, naturally protective, and medically recommended as the optimal source of nutrition for infants during the first 6 months of life and beyond. Essentials of breastfeeding. Colostrum. The yellowish milk produced in the first few days is rich in antibodies, nutrients, and immune factors. It's often called the baby's first vaccine. Exclusive breastfeeding, EBF, for the first 6 months. Babies should receive only breast milk, no water, formula, herbs, or food. Continued breastfeeding. After 6 months, solid foods are introduced, but breastfeeding continues until at least 2 years, as recommended by WHO and UNICEF. On-demand feeding. Feeding should occur whenever the baby shows hunger. Cues, day or night. Proper latching and positioning, crucial to avoid nipple pain. Ensure milk transfer and promote bonding. Effectiveness of breastfeeding. Supplies perfect nutrition in the right composition and temperature. Contains live antibodies, hormones, enzymes, and growth factors. Boosts brain development, especially in the first 1,000 days of life. Strengthens immune defense, reducing risk of infections. Supports emotional security and bonding between mother and baby. Health implications of breastfeeding. For the baby. Optimal nutrition. Breast milk provides all the necessary nutrients for an infant's growth and development in the first 6 months of life. Immunity boost. Breast milk contains antibodies and other immune factors that protect the baby from infections and illnesses. Protection against infections. Breastfed babies have lower risks of diarrhea, pneumonia, ear infections, and meningitis. Chronic disease prevention. Reduces long-term risks of obesity, type 1 and 2 diabetes, asthma, and childhood cancers. Neurodevelopment. Enhances IQ, cognitive ability, and emotional regulation due to essential fatty acids and bonding. Reduced mortality. Breastfeeding can prevent up to 13% of under 5 deaths globally, especially in low-resource settings. For the mother. Postpartum recovery. Helps the uterus contract, reducing postpartum bleeding and aiding recovery. Natural birth spacing. Exclusive breastfeeding. Can delay return of menstruation. Lactational amenorrhea. Offering temporary contraception. Lower cancer risk. Breastfeeding has been associated with a reduced risk of breast and ovarian cancer. Lowered risk of diseases. Protects against breast cancer, ovarian cancer, type 2 diabetes, and osteoporosis. Convenience. Breast milk is readily available. Requires no preparation and is always at the right temperature. Weight management. Breastfeeding can help mothers return to their pre-pregnancy weight. Emotional and psychological benefits. Promotes maternal confidence, bonding, and reduces postpartum depression risks. Starting and continuing breastfeeding. Early initiation. It is recommended to initiate breastfeeding within the first hour after birth. Exclusive breastfeeding. Exclusively breastfeeding means providing only breast milk and necessary supplements like vitamin D for the first 6 months of life. Positioning and latching. Proper positioning and latching are crucial for successful breastfeeding. Support. Seek support from healthcare professionals, lactation consultants, or support groups if needed. Continued breastfeeding. Continue breastfeeding alongside complementary foods for up to 2 years or longer, as desired by both mother and baby. Challenges and barriers. Cultural myths, e.g., colostrum is dirty. Lack of family or workplace support. Aggressive infant formula marketing. Poor health worker knowledge or inconsistent counseling. Maternal malnutrition and illness. cesarean delivery or delayed skin-to-skin contact, action plan to promote breastfeeding, community education, engage fathers, grandmothers, and religious leaders to dispel breastfeeding myths, promote breastfeeding through antenatal clinics, churches, mosques, and schools, health facility practices, initiate breastfeeding within the first hour of birth, ensure skin-to-skin contact and rooming in of mother and baby, train birth attendants and nurses on correct latch and counseling, support systems, establish mother-to-mother support groups, provide lactation consultants in hospitals and primary care settings, workplace interventions, enforce maternity leave policies, minimum 14 weeks, provide breastfeeding breaks and safe, private spaces at workplaces, public policy and advocacy, ban misleading formula advertisements, monitor and enforce the International Code of Marketing of Breast Milk Substitutes, integrate breastfeeding promotion into national, nutrition and maternal health strategies, nutrition and well-being of the mother, provide iron, folate, calcium, and protein-rich meals during and after pregnancy, offer psychosocial support and rest for breastfeeding mothers. Breastfeeding is less expensive than infant formula, but its impact on mothers' ability to earn an income is not usually factored into calculations comparing the two feeding methods. It is also common for women to experience generally manageable symptoms such as vaginal dryness, de Quervain syndrome, cramping, mastitis, moderate to severe nipple pain, and a general lack of bodily autonomy. These symptoms generally peak at the start of breastfeeding, but disappear or become considerably more manageable after the first few weeks. Summary: breastfeeding is life-saving, cost-effective, and foundational to lifelong health. It benefits not just the child, but the mother, family, community, and national economy. Despite its value, it remains under-practiced due to misinformation, social pressures, and lack of systemic support. Conclusion: breastfeeding is not just a maternal instinct, it's a public health intervention. To ensure every child gets the best start in life, we must normalize, support, and protect breastfeeding through health systems, communities, workplaces, and policies. Every feed is a step toward a healthier generation.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.